no one is safe until everyone is safe. No one country has access to research and development, manufacturing, and all the supply chain for all essential medicines and materials. And if we can work together, we can ensure that all essential workers are protected and proven treatments like dexamethasone are available to those who need them. With PPE and tests, a collaboration between the public and private sectors meant supply was increased in order to support fair and equitable use of scarce products. As new diagnostics, medicines, and vaccines come through the pipeline, it's critical that countries don't repeat the same mistakes. We need to prevent vaccine nationalism. And for this reason, WHO is working with governments and the private sector to both accelerate the science through the ACT Accelerator and ensure that new innovations are available to everyone, everywhere, starting with those at highest risk. Since May, WHO has been in extensive consultations to develop a new framework to guide fair and equitable access to diagnostics, therapeutics, and vaccines for COVID-19 across all countries. These cross-cutting principles are key to the promotion of equitable access and fair allocation of these essential health products for the greatest impact globally. For example, once a successful vaccine has been identified, WHO's Strategic Advisory Group will provide recommendations for their appropriate and fair use. The allocation of vaccines is proposed to be rolled out in 2 phases. In phase 1, doses will be allocated proportionally to all participating countries simultaneously to reduce overall risk. In phase 2, consideration will be given to countries in relation to threat and vulnerability. Frontline workers in health and social care settings are prioritized as they are essential to treat and protect the population and come in close contact with high mortality risk groups. Initial data has shown that adults over 65 years old and those with certain comorbidities are at the highest risk of dying from COVID-19. For most countries, a phase 1 allocation that builds up to 20% of the population would cover most of the at-risk groups. If we don't protect these highest risk people from the virus everywhere, and at the same time, we can't stabilize health systems and rebuild the global economy.